Well, I'm Dr. Upendra Kaul, Chairman, Batra Heart Center, Batra Hospital and Medical Research Center, New Delhi. The study which you are referring to is South Asian Heart Failure Registry, which has been conducted in our country in 14 different hospitals all over the country, with the basic idea of finding out what is the optimal treatment for patients with heart failure with symptoms, and there is a subset of patients who also have in electrocardiogram a left bundle branch block, and it's well known that patients with heart failure and left bundle branch block benefit more with a device called CRT and CRT-D. So we wanted to find out what is its acceptance and what's its uh, efficacy in our Indian population. Well, 472 patients were recruited in this study all over the country, and they were all patients who were on good medical treatment, evidence-based medical treatment. It's the best possible medical treatment, which consists of ACE inhibitors, beta blockers, diuretics, and spironolactone. All those medicines were there, and then all these patients also had left bundle branch block in the ECG. So it is a registry, it's not a randomized study. So all of them were offered once again an evidence-based medicine treatment called implantation of a device which synchronizes the contraction of the heart. That is, the left ventricle and right ventricle contract together, whereas in left bundle branch block, because of the block, it is the right ventricle which contracts first and left ventricle contracts later, with the result that the rhythm and the cardiac output gets lower because it's not synchronized. So they were all offered this treatment. Well, first of all, only 25% of the patients accepted this treatment. Others did not accept for various reasons, and one of them is financial reason. Other reasons could be lack of awareness, lack of motivation. The patients who accepted this treatment did much better than the patients who continued on good medical treatment. Good medical treatment, evidence-based medical treatment was given in all the patients, not that patients on CRT were not given it. So it was seen that about 3/4 of the patients improved markedly by giving this device in terms of symptoms, possibly in terms of longevity, and also in various scores of efficacy, as compared to the other patients who did not have it, where they had higher mortality, they had more symptoms, and their quality of life was not so good. Well, it's a very good question. Heart failure patients in India are in general 10 years younger, and their hospital mortality is significantly higher. One of the reasons being they come late for hospitalization, and number two, the treatment which they have been taken in the hospitals or outpatients departments is inadequate. The doses which they are taking is inadequate. So mortality is high, and the underlying disease is quite extensive in Indian patients as compared to Western cohort. Well, CRT-D is not meant for all patients with heart failure. First of all, I would like to emphasize, it is meant for those patients who have got, in addition to heart failure with reduced ejection fraction, that means the ejection fraction less than 35, a ECG abnormality called left bundle branch block, in which the QRS complex of the ECG is more than 0.12 or 0.14. In this situation, the two ventricles do not contract simultaneously. They contract in a dysynchronous manner. That is, the right contracts first and the left, because of the conduction system has a problem of LBB. And 20 to 25% patients of heart failure do have left bundle branch block. So by giving this special pacemaker, which paces both the right ventricle and the left ventricle and also the atrium, it synchronizes the contraction. That means the right ventricle and left ventricle contracts together. In addition, we always recommend that CRT should be combined with CRT-D, because these patients are also prone to sudden death. CRT-D means, in addition to this biventricular pacemaker, they have a defibrillator, which is a part of the device, and in case they get a serious arrhythmia, cardiac arrest, this gives a shock also. So it synchronizes the cardiac rhythm, synchronizes the cardiac contractions, and also has a backup for giving a shock in case of a cardiac arrest. First of all, because patients of heart failure are all over the country, all of them are not sitting in metropolitan cities, all of them do not have access to doctors who know about this therapy. So first of all, continuing medical education programs for the doctors all over, that any patient with heart failure or any patient with shortness of breath, you should rule out heart failure. And if heart failure is there, give them good medical treatment of heart failure. And heart failure, good medical treatment is all, guideline based. ACE inhibitors, beta blockers, and there are some newer drugs which have replaced ACE inhibitors like angiotensin, called the ARNI, that is the angiotensin receptor neprilysin inhibitors. Give them that medication, and if the patient has left bundle branch block, in addition, they should be offered a CRTD. Why I say offered? Because it's an expensive device, and it should not be forced upon a person who has to sort of sell off his property and other things, or his family suffers. Should be offered, and we should have better healthcare systems. We should have more insurance prevalent in the society. We should also have more access to these devices, this medical treatment. Or that is a healthcare policy of the government, of the health ministry, which is again state-wise. Health policies are made in the center, but they are all state governments have to go on that. So it has to be a very comprehensive policy in which the benefit of these patients, which are very often young people, they're not 90 years, 85 years of age who have passed their prime. There are many of them are young people, and these patients benefit significantly in their symptoms and also live longer.